Sometimes we may think that we don't have a voice working in large environments, uh, particularly large hospital settings. When we do, it doesn't always have to be to have a voice. One may think, I'm gonna get you, sucker. I'm gonna get you, you know. Um, so today I wanted to talk about a scenario which some of the things I may say can relate and just have us thinking a little bit. And it can relate in other relationships besides the workplace. For example, intimate relationships, business relationships, family relationships, any type of relationship. And in this situation, I'm talking about, say for example, you're working in a hospital setting and you have a patient come up to you and they say they have a complaint about, let's say it's a doctor, and they were very unhappy with the doctor's care or demeanor or something, but they come to you to complain, and you happen to be one of the people that turn in complaints as a patient advocate, a patient representative, someone that is have a position in the organization to turn in complaints. So in this situation, I can share with you some of the ways I handle this. And then I'll read to you some documentation I have here. So in situations like this, it can become difficult depending on how we think and how we act or perceive things. I'm trying to figure out a way how to talk about this. So if you are personally, if there's like a conflict of interest per se, and you are, you laugh, you joke with this particular doctor, this particular doctor is a good-hearted person, you go to the break room, you eat with that person, and even have accepted gifts from this particular person, this doctor that the patient may be complaining about. So, but you must act, not must, it's your choice, to say, am I going to turn this complaint in, or am I going to just sweep it under the carpet and act like I didn't hear a thing? So for me, I'm going to share how I am able to I will turn the complaint in, and however I will approach the doctor, make sure the timing is right, and say things like, on that last patient or whatever patient, if you don't mind, go ahead and, just document what happened, because I'm going to have to turn in they came to me and I'm going to have to turn in a complaint. So because of the respect me and this doctor have for one another, they're not going to look at me crazy or yell and fuss at me and say, that patient, it was their problem, they're the difficult one, and this and that or whatever. They'll just look at me and go, okay, I got you. And now, if it was a difficult doctor, then I wouldn't approach them and be honest with them and let them know I'm turning something in, because I know they won't be able to understand, like, what are you doing? I represent this agency. I'm the superior one as far as the doctor. You need to ignore that patient because they're a frequent flyer. They come in here all the time, and they're just bad people. And we're the good people. So you just need to ignore it and don't report that. Something like that. So let me go in my car. I got something to read on this topic that I'll share with you. Okay, although I know it doesn't matter to some as far as documentation or just reading from evidence or research, but I not only talk from what I've learned, and try to share that way, but I like to have some documentation as well. I think it's the right thing to do. So here it says, maintaining professionalism in hospital workplace environments. And my focus is, through what I talk about, is to say that we may think in large organizations that we do not have a voice, but we do. And we don't have to wait for or during conflict to let our triggers show our anger to get our voice across, or uncontrollable behaviors that we have not worked on get the best of us, but we still can have a voice in a large organization, depending on how we do it and how we express it. So, in a large hospital workplace environment, it is crucial to maintain professionalism and handle sensitive situations with dignity and respect. When a patient comes to you as an administrator to complain about a staff member, especially a doctor, it can be challenging to navigate the situation without pointing fingers or causing conflict. So here are some steps they list here to address the complaint while upholding professionalism and respecting all parties involved. So with the patient, you want to listen actively and with empathy. When the patient approaches you about a specific doctor, it is essential to listen very carefully, show empathy towards their concerns, and make sure the patient feel heard and understood before proceeding with any actions, like to say, here's a report of contact, I can file this for you, and make sure it gets into the right hands, and somebody will be contacting you, blah 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 blah, right? So to listen also and say, you're listening, you're taking it in, you're understanding, does not mean, say for example, that's a bad doctor anyway, oh, that's a really good doctor, you shouldn't feel that way, or yeah, that, I've noticed that the one surgeon that always patients always come in with infections after surgery, or Like, give that, none of that is necessary. Like, I'm just talking from experience. You can be who you are, but I'm telling you, that does not, that's not the purpose. That's not something we should be focused on. That's none of our business. But to the person coming to you, regardless if they are a frequent flyer per se, always coming to the hospital, always complaining, they may piss on the floor, they may have taken out their sanitary bloody napkin and threw it at somebody on another occasion. It doesn't, those things matter, but they don't. Because that person is now coming to you and saying how they feel. And if you're in the position to listen to that person and take their complaint, and that's all you do, because that is the job that you have if you want to do that job. And even if it is the job you have, if you don't want to do it, that's your choice, right? But regardless of who they are, it's just about listening, and I try to do what's right and file the complaint. Validate the patient's experience. Acknowledge the patient's feelings and experiences regarding their care without making any judgments or assumptions. Validating their concerns can help build trust and rapport with that patient. Maintain confidentiality. It is crucial to handle the patient's complaint with the utmost confidentiality to protect their privacy and maintain trust in the healthcare system. Avoid discussing issues with colleagues or sharing details that could compromise the patient's confidentiality. What did they say? Are they, you really going to turn that in? And you're going to, what's wrong with you? And, just maintain their confidentiality, what they'll talk about with you, because it's between you and them, right? Don't defend, don't explain, don't engage, don't personalize in this situation. Separate, know how to separate your personal relationships from personal responsibilities. While it may be challenging to receive a complaint about someone you have personal interactions with, it is essential to separate your personal relationships from your professional responsibilities. Now, say, for example, if it was turned on me, and the person a patient is complaining about me, I must respect the same thing. If someone say, Emily, I have to turn this in because they made a complaint on you, I say, okay. And so I know to document accordingly on my end what has happened, just in case I need to do a rebuttal and explain myself when the question, from management, and they say, why? What you do this for? Blah, 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 blah. But I already have my documentation saved, waiting for the moment to come. I'm not going to tell the person, please don't tell on me. Please don't turn that in that the patient complained about me. I mean, we never know the situation and the misunderstanding that could have happened. Just the way I expect someone else that is normal, I'm not talking about those difficult people, to respect that I have to turn things in. I have to be willing, on the other hand, as well, that people turn stuff in on me too. So it's not a one side, my way or the highway. It goes both ways. So document the complaint. As a patient representative, it is your duty to document the complaint accurately and submit it through the appropriate channels for further investigation and resolution. Ensure that all relevant details provided by the patient are recorded for references. This is not something to get in an uproar about, because if you're doing the right thing, if you know you're doing the right thing, if you know that other person is doing the right thing, you have nothing to worry about. And people know that. You just got to go through the process of explaining, and then the analysis to come out of how to handle things differently, if need be, etc. I'm gonna skip through that because this next part I want to go through this here. Choose the right time and setting when approaching someone that you need to turn documentation in. Offer support, assure that doctor that you're available to support them throughout the whole process. Encourage communication and let them know that their perspective on the situation is valuable. I'm going to leave that at that, but also know it's good to know personalities and behaviors, because some people you cannot approach. Some people, if you do this to, you will be attacked, and it's going to come back to haunt you, where you need to watch your every move and every step, because people are vindictive. And there's, it's not just one way to talk about this situation. There's many ways to talk about it, and I just wanted to bring that out today. All right, peace.